Together we achieve victory over heart failure.
Hi, this is Dr. Ravi Jainapur, working as a consultant cardiologist in SDM Narayana Heart Center, Dharwad. Today, we are discussing about most important aspect, that is heart failure, how to recognize the heart failure, and what are the clinical effects, as well as what are the vital signs, and what are the particular parameters that we have to remember. Coming to the critical aspect of healthcare, that is about heart failure, it is important to monitor heart failure conditions. It is very difficult to notice heart failure right away. As our heart increases strain, it compensates by working harder. Yet, as heart failure progresses, its ability to pump blood diminishes gradually. Over time, subtle changes may go unnoticed, emphasizing the importance of recognizing heart failure symptoms very early. Once heart failure progresses, there will be signs like there will be swelling in the feet, ankles, as well as abdomen, and you may notice sudden increase in the weight gain. These are the common signs of heart failure once heart failure progressed into higher stages. You can monitor the weight to see how heart failure is progressing or whether it is regressing. Another important symptom is being shortness of breath during normal daily activities, and if you get persistent coughing as well as wheezing, which warrants medical attention. And sometimes you may get sudden breathlessness when you sleep during night. We call it as orthopnea. That is a very, very important sign. As well as once if you get up at the overnight because of sudden onset breathlessness, that we call it as a paroxysmal nocturnal dyspnea. That is one of the most important symptom of heart failure. You may have other symptoms like fatigue, confusion, fainting, that will indicate inadequate blood flow to the brain. There are very subtle signs of like a rapid heart rate, nausea. If you may not feel to eat, we call it as a lack of appetite. These all indicate there is some or the other heart problems. So if you notice any of these signs or symptoms, it is very, very important to seek medical care as early as possible. Let us discuss about some heart numbers that we regularly come across and that should be monitored properly. One thing is blood pressure. High blood pressure is very harmful because it makes heart work harder and work less efficiently. Fortunately, this high blood pressure can be detected very easily. Normal blood pressure, as guidelines say, it should be less than between 120 systolic and 180 diastolic blood pressure. We call it as a elevated if heart the systolic blood pressure is more than 120 and diastolic blood pressure is more than 80. And you call it as a patient as hypertensive if systolic blood pressure is more than 140 and diastolic blood pressure is more than 90. In between 120 to 140 systolic and 80 to 90 diastolic is considered as a borderline. We call it as a pre-hypertensive, where even before going into hypertension, you can diagnose and you can treat them earlier. Another important aspect is the cholesterol levels. The cholesterol is one of the substances that leads to multiple problems, not only cardiac, it leads to multiple other comorbidities also. So, what are the normal levels of cholesterol? What should you know is there it depends, it vary according to the age also. For persons less than 19 or younger years of the age, LDL cholesterol less than 110 milligrams and HDL cholesterol more than 45 milligrams. LDL means low density cholesterol and HDL means high density cholesterol. For the men more than 20 or older, LDL cholesterol less than 100 milligrams and HDL more than 40 milligrams. And for the women's more than 20 and older, LDL cholesterol less than 100 milligrams and HDL cholesterol more than 50 milligrams. These are considered as abnormally high cholesterol levels. If you find these levels higher, it is better to control either with diet or with medications as prescribed by the health professional. Another important thing what you should see regularly is heart rate. Heart rate is the number of times your heart beats per minute. Your resting heart rate is the lowest heart rate your heart beats when you are not exercising. Typically, it will be between 60 to 100 beats per minute. When you are calm, relaxed, and not having any health issues. For moderate exercise, our aim is to increase to 50 to 85% of your maximum heart rate. Many variable activity trackers can monitor your heart rate during exercise and throughout the day, helping you to keep tabs on your cardiovascular. This concludes today's discussion about monitoring heart failure conditions. And hopefully, this has given some idea about particular parameters as well as the symptoms that should be noticed. If you experience any of these symptoms, you have to consult healthcare professionals as early as possible. Thank you very much.